Greetings, peeps. Salut. How are they? Welcome back to another very informative and educational video. It's your host, Dr. JB, and we're back again. And in today's video, we're talking about sexually transmitted diseases, and I want to put it generally under the class genital infections. Yeah, the diagnosis and treatment of genital infections present several difficulties. Clinical features are not specific. Many infections are what we call asymptomatic, that you can be having a genital infection like a chlamydia infection for years and you don't know, and it's there killing you inside and rendering you sterile. Chlamydia is the devil. I'm just kidding. Yeah, it could be the devil. It leads to sterility, untreated chlamydia infections. So like I said, they are so asymptomatic. Oh, guys, by the way, all the things you see playing in the background, there are different drugs, different antibiotics we'll be discussing, which you can be able to help yourself if you listen keenly right to the end of this video. You will see I'll give you details how to detect whether you might be having a chlamydia infection, a gonorrhea infection, or is it genital herpes, or is it candidiasis, sugar, the way the lady calls it, or the way they call it in the quarters. Is it the vagina candidiasis? Is it vaginitis? Is it trichomoniasis? All those things, you know all the different diagnoses, and you know possible treatments if where there is no doctor. Let's say, we don't know. Cameroon is funny. So for my Cameroonian viewers, it will help you a lot, even for the international viewers in the diaspora and everywhere. So let me go right straight to the point. Like I was saying, many infections are asymptomatic. Laboratory tests are available in the field, are always very reliable. Okay. There are mixed infections are common, like gonorrhea and chlamydia. When you're treating for gonorrhea, you should always treat for chlamydia. That's one thing you should know. Okay, medics know that. Okay, partners also need to be treated. Yeah, as a couple, you should know when you're treating yourself for an infection, you need to definitely treat your spouse, especially if you know you must have indulged or you have been indulging in unprotected sexual encounters. Okay. Okay, so you need to treat your partner simultaneously. Okay, in case of sexually transmitted infections, know that. Okay, and I'm going to let you know what we call sexually transmitted infections. Okay, and know that the risk of recurrence or treatment failure is increased with HIV infected patients. Okay, and fortunately for you guys, the World Health Organization introduced a syndromic management of genital infections and developed standardized case treatment flow charts. You understand, like how to diagnose which infection is which one. If this is there, if this is absent, you check for this, or you will likely be this, and what you treat with. Okay, so I'm going to give you some basic principles you should know. You should know that when it comes to genital infections, every patient can be effectively treated without laboratory testing. Okay, you must not go to the lab. Okay, some tests may help in diagnosing vaginal and urethral discharge, but they should never delay treatment. Okay, results are often available like within an hour. Okay, and you should know that patients should be treated at his or her first encounter with the health personnel. Okay, no patient should be sent home without Man, okay. Oh, those are bases. Those are bases for us medics. No, I will not jump into that. Okay, you should know that they are single dose treatments, so do not carry around an infection for no reason. Meanwhile, if you're scared of tablets or injections, know that most of these things are treated just with a single dose. Okay, the standard treatment of chlamydia on uncomplicated acute chlamydia infection is just 1 gram of azithromycin as a single dose. You got what that I said? So that's so simple. The standard treatment of acute candidiasis, vaginal candidiasis in females and in males is just a single tablet of 150 milligrams of fluconazole. Just know that they are single dose treatment and stop carrying around untreated genital infections, be it sexually transmitted or not. Okay, so I'll be going down into some typical cases. Okay, let's take a typical case of urethral discharge. Okay, urethral discharge is seen exclusively in men. Okay, when we talk about urethral discharge, it's seen exclusively in men. Okay, and the principal causative agents are Neisseria gonorrhea, what causes gonorrhea, and Chlamydia trachomatis, what causes chlamydia. Okay, the presence of abdominal discharge should be confirmed by performing a clinical examination. That's in the hospital. In males, the urethra should be made gently. Okay, if no discharge is visible, all the stuffs are hospital stuff, but they're interesting. You need to know these things. Okay, don't be embarrassed when you go to the hospital or you're having a urethral discharge. These things are common, so follow right up to the end. Okay, if you are getting value from this video, be sure to hit that like button, share with a friend, for sharing is caring. My goal is to keep creating videos like this. I know these are very common things and people are still shy about, people are uninformed about. I want to provide information to social media that you can see it everywhere with internet connection and know these things, what is happening. Okay, I'm doing it for Cameroon, I'm doing it for the world, I'm doing it for to make a change. Okay, so like this video and subscribe for more. I'll be continuing by saying when you're having a urethral discharge as a man, okay, the first question you should ask, okay, it can be a urethral discharge or it can be a painful urination. If there's a urethral discharge, we think of gonorrhea and chlamydia and we treat for them both, basically in man. So know that as a man. And the treatment is simple and it's similar for what they call cervicitis in female, which is an inflammation of the cervix. It's very simple. It's just 1 gram of azithromycin, or you take doxycycline tablets 200 milligrams per day. It can either be in 2 divided doses or as a single dose, but I advise you to take in 2 divided doses for 7 days. Okay, very simple, 7 days treatment. That is the standard treatment for chlamydia. Okay, those 2 treatments are standard and it goes for both male and female. In males, we talk about urethral discharge or even dysuria. Okay, and in females, we talk about cervicitis, which is an inflammation of the cervix, and it might be one of the most common symptoms is dysuria, that's painful urination. Okay, and know that the standard treatment for gonorrhea, which will be accompanied by the treatment for chlamydia, like I always say, the two are handled together, is ceftriaxone 250 milligrams IM as a single dose. And if ceftriaxone is not available, you can give the person cefixime 400 milligrams as a single dose. Cefixime is common antibiotics. I'll be showing you'll be seeing it in all these, among all these antibiotics I'm displaying to you. Come on, I want to create a podcast on YouTube. I want to create a podcast, and I'll create the idea. It's a low budget podcast. Guy, if you want to support me, oh. I need good mic, I need good camera. I want to create a video podcast. But for now, since I don't have good video equipment, I'll be doing it like this, and it will be more of an audio podcast, okay? So, like I was saying, the treatment for gonorrhea is 400 milligrams of cefixime as a single dose. Okay? And that's it. So simple. And you know, if you enter discharge reappear, that if it persists after maybe like 7 days, you should visit the doctor. You should visit a hospital. Okay, let's say you had these symptoms and you rushed to the pharmacy and got this, and it persisted. Go to the hospital. I'm saying this why a lot of people will want to listen to this thing and know about it, and because they're shy to go and complain. Okay, but I don't advise you to be shy. Go. If you're having these symptoms, visit the pharmacy. The pharmacists are the most closest. Talk to one, especially those. I know, I thought the Harmonia pharmacists are professional. Talk to one, complain. Or you visit a clinic, consult. Visit the hospital, consult. It's important. It's important. Your sexual health is important, okay? So, you should know that there have been cases of gonococcal resistance, cases of gonorrhea which are resistant to treatment, okay? And there's another treatment that you can use, cotrim, what we call cotrimoxazole, okay? Or kanamycin. Kanamycin is an antibiotic which is injectable, okay, to treat gonorrhea in cases of resistance. Chlamydia is rarely resistant, like 1 gram as a single dose, 1 tablet per day for 3 days to be repeated every week for 3 weeks is very efficient. Guys, I'm giving you tips of things that you want to know about, okay? Things that you should not be reading about drugs which are maybe the trade names are found in India or in Nigeria, and you're going to the pharmacy and asking for stuff. For those of you in Cameroon, you really benefit from this video, trust me. I just thought we just celebrated World Pharmacist Day yesterday, and as a proud pharmacist that I am, I had to make this video because my boss mentioned Dr. J. Moses, Dr. Timan J. Moses. He mentioned that we have not even done an activity to sensitize like the farmer, like the population, or even at the pharmacy level. Like the last time he did a poster on antibiotics resistance, okay? We sensitize the public on antibiotic resistance just by carrying some antibiotics, snapping them, and making a caption and posting to sensitize about antibiotic resistance, common antibiotics. That was really smart, okay? So I just wanted to make this video so to sensitize the public when it comes to genital infections, the common ones, and the signs and symptoms. And now we go to the ladies. Abdominal vaginal discharge, okay? And when you're having abdominal vaginal discharge, every lady knows when it's normal, when the discharges are normal, when it's abnormal, okay? Abdominal vaginal discharge is simply when your discharge differs from the usual, which respect the color, the odor, and the consistency. When it becomes discolored, or we call it purulent, or it smell bad, malodorous. That's big grammar, okay? When it's like that, know that there's a problem. Abdominal discharge is often associated with vulvar itches or pain during intercourse, okay? And it's also often associated with painful urination, okay? And maybe pain in the lower abdomen, okay? When you're getting this symptom, ladies, you know, routinely you should check for abdominal discharge. In woman who come check for abdominal discharge when like a medic, okay? Those one in medic stuff. I will not go into details, okay? And most of the common symptoms, okay? Abdominal discharge is often a sign of what we call vaginitis. That's a vaginal infection, inflammation of the vagina, or vaginal infection. Infection always causes inflammation mostly, or cervicitis, which might touch the vagina and also touch the cervix, inflammation of the cervix. And it can also include an upper genital tract infection, okay? And the main causative agents are, we have Gardnerella vaginalis, which is a bacteria that causes bacterial vaginosis. And when you have this one, you start having a vagina. Oh, YouTube. Oh, I'm not supposed to pronounce that word. It smells down there like rotten fish. Okay, that's a common smell of this one. It's a bacteria that called rela vaginalis, big grammar. And trichomonas vaginalis is also another cause of vaginitis. That one is a protozoa. Okay, and this one Flagyl treat it. Flagyl 4 tablets single dose. Secnidazole 4 tablets single dose. Tinidazole 4 tablets single dose. Or you can repeat it after 1 week. Most cases. Know that these things are treated with single dose treatment. Most cases. And also one common causes of vaginitis is candida infection. Sugar when it's itching down there, when you want to just send your finger and be scratching it. That's one cause. And this thing is treated with a single dose of 150 milligrams capsule, mostly cases of capsule like Flucel 150 milligram. Pap, single dose, you are done. Fluconazole 150 milligram tablet, single dose. These things is treated like that. In most cases, you repeat after 1 week. And in most cases of resistance, you repeat the treatment daily for like a week or 2, and the thing goes. In cases of resistance, but in most cases acute and is treated as a single dose just because people carry them around. And the most cause of cervicitis, because what is common in women is vaginitis, which is bacterial vaginosis and trichomoniasis and candidiasis, sugar. But when the most common cause of cervicitis rather is the gonorrhea bacteria and the chlamydia man. Okay, so chlamydia and gonorrhea are the most common who go out their cervix, so it's more dangerous for you women. So when you're having menstrual sugar, it's less dangerous. But when it's gonorrhea and chlamydia, which can be asymptomatic or which can be accompanied by discharges, abnormal discharges, women, be careful with this. When it's not just pasty discharges, which is the common with sugar, like when it becomes like watery and slimy and other changes, is somehow, be careful. Okay, it can be an upper genital tract infections. Okay, so in most cases in women, when we suspect that, like, the analysis to analyze yourself like a woman, which one you can be having. When you're having vagina itches, when it's burning, when your vulva is burning or itching. Okay, if you're having abdominal discharge and you're having lower abdominal pain, and just know that you might be having a bacterial infection in the vagina, the one we just call Gardnerella vaginosis, and you can be having trichomoniasis if you are the woman that swims in the pool, and in most time you might experience like something is just pricking you. That one is in males, trichomoniasis, because it's a parasite, and it's common. People like visiting pools, bobos, go to pool in the pool for weekend. Okay, they can have stuff like that. So if you are a woman and you're having that itches and burning, and you're having low abdominal pain, okay, and you're having discharge, you should be suspecting at once. If you cannot go to the lab, just treat yourself for gonorrhea, syphilis, treat yourself for vagina, what we call vagina vaginosis. That's bacteria, the most common bacterial infection of the vagina. Many obvious that have been showing you here, and antibacterial like Genital will handle that bacterial infection. Genital obvious. Flagyl will handle it. Okay, so I will discuss it with you furthermore. It's not like I'm saying that you should forget about doctors. So I'm just saying that you should know an idea. Don't be too shy. Don't be too lost. And if you, nowadays people you will not go to the hospital. If you know a doctor in the family, you present them your symptoms. They can take your sample, send you to a trustworthy friend if you are too shy, and stuff like that. But why should you be shy? It's your health. Alright, treatment for chlamydia and gonorrhea, like I said, it remains the same. Azithromycin 1 gram single dose, doxy 200 milligrams. You can buy doxy 100 milligrams capsule. It comes in a box of 20. You take one morning, one evening, 7 days. That's 14 of the tablets. You'll be left with 6 tablets to 2. And ceftriaxone injectable 250 milligram IM single dose. Papillomavirus 250 IM. You go. Single dose, you're finished. So know that these things they go as single dose. 400 milligrams cefizine single dose. But in most cases we give you like the one pack of cefizine for 10 tablets. Even sometimes 2. In most cases 1 pack enough. 2 times a day, 5 days. You know that you have covered both gonorrhea and chlamydia, and you also cover like menstrual. 4 tablets a single dose. Pap, that's 2 grams. Or the common one, the most advanced one is tinidazole. I've been showing you all along. 2 tablets, 4 tablets a single dose, that's 2 grams. For sugar, clotrimazole ovus. There's a 500 milligrams ovus of clotrimazole, single tablet, single dose. Instead at bedtime, you are fine. I'm telling you about sugar treatment. Yeah, old ladies. I'm going to make a video about this, so I'll not go more into details. Okay, make sure you treat your farmer. Nystatin also handle sugar. Clotrimazole 100 milligrams, box of 6, 1 morning, 1 evening for 6 days. Yeah, ladies, it's short. Sugar treatment is short. Even the miconazole cream, you apply there morning, evening, your vulva for 7 days. You will be fine. It's your boy, Dr. J. They call me the pharmacist who is specialized in sexology and cosmetology and swagitology and shobishology. So away again with a video about genital ulcers, which is common, and you should be one of the most common causative, the herpes simplex virus. Okay, and also Treponema that causes syphilis, also a very common one. Okay, syphilis is one of that stubborn sexually transmitted infections too. Okay, and it manifests itself with ulcers. So syphilis, ulcer, when you have ulcers, wounds in your vagina, you should be suspecting that syphilis or the viral one, herpes, which is treated as a COVID pain. You can also the herpes zoster of the skin, which is painful. Some people call it mosong. I'll make a video about it. Also had a problem with it too. So guys, till come your way again, I don't want to talk much. Okay, I'm that guy who can host a post class from morning to evening, and because before my one go being a doctor from journalism be there. Okay, being one of the hobbies. Okay, so till I come your way again for another video, make sure you subscribe, like the video if you gain value for it.